Today, we're going to dive into a crucial but honestly often overlooked part of your body. It's this tiny little joint that has a massive job. So let's talk about the unsung hero of your wrist, the DRUG. I mean, just think about it for a second. All of these simple, everyday actions require your forearm to twist with some incredible precision. So, what on earth makes that seemingly effortless movement even possible? How does that work? Well, the answer is the distal radial ulnar joint, or as we'll call it, the DRUJ. This is the critical pivot point right there near your wrist, where the two bones of your forearm, the radius and the ulna, meet and perform this kind of mechanical magic. So, to really appreciate what the DRU does for us, we've got to understand how it's built. Let's take a closer look at the actual blueprint. Okay, so this image here pinpoints the DRUJ's location perfectly. You can see the radius, that's the bone that moves, and the ulna, which kind of acts as a stable anchor. The DRUJ is that elegant connection that lets the radius just swing right around the ulna. You know, a really great way to simplify this comes from our source material, which suggests this brilliant analogy. Think of your forearm stability as a three-locker system. You've got the joint near your elbow, the joint at your wrist, our DRUJ, and the connection running right down the middle. All three have to work together. But here's the thing, it is not just about the bones, not at all. As you can see here, the DRUJ is held together by this whole intricate web of soft tissues. The absolute MVP is the TFCC. That's a tough piece of cartilage that acts like a cushion and a stabilizer. And it's supported by all these ligaments, membranes, and muscles, all working in perfect harmony. Okay, so this is the part that just blows my mind. Check out this number. Up to 80% of the DRUJ's stability doesn't come from the shape of the bones, but from that network of soft tissues we just saw. That's why an injury to those structures can be so devastating. And that brings us to this central conflict of our story, right? What happens when this finely tuned system, this stable joint, just breaks down? Well, the result is a condition called DUJ instability. And listen, this isn't just some minor ache. It can seriously impact a person's life, making those simple tasks we talked about, like turning a key, incredibly painful and difficult, not to mention it just kills your grip strength. So, how do doctors even figure this out? One of the main tools is something called the ballottement test. A clinician will carefully hold the radius bone perfectly still and then gently press on the head of the ulna to feel for any excessive movement or looseness. It's a really hands-on way to check the integrity of those all-important stabilizing tissues. But the clues don't stop there. Doctors are kind of like detectives here. They use other specific tests, like checking for a tender spot called the fovea sign, or doing the press test, where just trying to push yourself up out of a chair can reveal that underlying instability. Every single test provides another piece of the puzzle. Now let's be clear, this instability doesn't just pop up out of nowhere. It's almost always the result of specific, traumatic injuries. So let's take a quick look through a gallery of the most common culprits. Okay, take a look at this. This is one of the most common wrist injuries out there, a distal radius fracture. As you can see in this x-ray, when that radius bone breaks so close to the wrist, the force of the injury can easily damage the nearby DRUJ and all its crucial soft tissue supports. All right, if you thought that last one was bad, this next one is, wow. A Galeazzi fracture is what's known as a fracture dislocation. So not only is the radius bone broken further up the arm, but the DRUJ itself is completely knocked out of place. It's a real double whammy of an injury that needs immediate attention. And this is what can happen down the road if those injuries aren't managed correctly. This x-ray shows a chronic dislocation, where the ulna has permanently shifted out of its proper place. This is going to lead to persistent pain, arthritis, and a major loss of function. So this table really puts it all into perspective. What's kind of interesting is that an isolated dislocation of the DRUJ without any broken bones is actually pretty rare. But look at Galeazzi fractures. They make up about 7% of all forearm fractures. That just shows you how often this joint gets caught up in major trauma. All right, so we've seen the problem, we've seen the injuries. How do medical professionals actually resolve DRUA instability and get patients back on track? Let's talk about the resolution. It all starts with getting a really good look inside. A standard x-ray? Great for seeing bones. But an MRI is the master at visualizing those critical soft tissues, especially the TFCC. And for a truly dynamic look, I mean, the really cool stuff is a 4D CT, which can create a 3D video of the joint in motion. That helps surgeons plan with incredible precision. But when you need the absolute definitive answer for what's wrong, well, this quote from our source material says it all. Wrist arthroscopy, which is a minimally invasive procedure where a tiny camera goes right into the joint, is the gold standard. It lets surgeons see the damage firsthand, and in a lot of cases, they can fix it right then and there. And that leads us right into treatment. And you gotta understand, there's no single magic bullet here. It's not a one-size-fits-all approach. For minor instability, splinting and physical therapy might be all you need. But for really severe cases, the solutions can be as complex as a full joint replacement, which is known as an arthroplasty. So, what's the bottom line in all of this? It's pretty simple, actually. A precise, accurate diagnosis is everything. From understanding the anatomy to using the right kind of imaging, the better we can define the specific injury, the more effective the treatment is going to be. And that, of course, means better outcomes for the patient. And that leaves us with this really fascinating question for the future. With technologies like dynamic CT and AI-powered analysis getting better and better every day, are we moving toward a world where we can not only fix these injuries, but maybe even predict and prevent them from ever happening in the first place? It's a powerful thought for the future of this amazing, unsung hero of the wrist.